Afternoon, everyone. My name is Casey Compton. I am the HR generalist out of the corporate office. I'm also the benefits specialist, and I'll be conducting this afternoon's corporate new hire orientation. So this will be a high-level orientation, and you'll get more job-specific training throughout the week and in the next few weeks to come. So this afternoon, we're going to cover company history. We'll go over company culture and the company footprint. Ways to be effective in your role, the employee handbook. As a part of this orientation, there is a harassment and bullying training, so I will let you know when we get there. And there is a short 10-question quiz that you'll need to take. The link to that is in the welcome email you received, so you'll need to go in and take that quiz. As long as you're paying attention during the training, you will not need to take any notes. We'll touch on benefits available to both part-time and full-time staff, as well as do a quick ADP demo and show you around ADP, which is our payroll system. So to give you a little company background, Care Advantage was founded in 1988 by a nurse named Debbie Johnston. And prior to starting Care Advantage, she was actually working in a hospital and was noticing that patients were being discharged from the hospital without having that necessary one-on-one care in their homes. This was leading to the patients being readmitted. They didn't have that care they needed, so they weren't able to stay safe after that they were discharged. So she decided to start Care Advantage. The company did start out as a family business, so she ran the company and her siblings worked with her in various leadership roles. And then in 2017, the company was bought by Bell Health, which is an investment company out of New York. And then we did change ownership again in 2021, and our new owner is Searchlight Capital Partners, which is another private equity firm out of New York City. So with these new partnerships and new ownership, we've been able to grow and expand as an organization, and we did get new leadership. The Johnson family did disperse. Debbie is still on our board, but we do have new leaders at the helm of the company. And in this time, the last 5 years, we have grown quite a bit. And so you'll see that growth in the next couple slides. But before we get to that, we'd like to start with our mission. So our mission as an organization is we exist to lift up every community we serve, to enable aging adults to live life to the fullest, and to empower our care family in their purpose-driven work. Next, you'll find our strategy on a page, and this was created after our ownership changed to Searchlight Capital Partners. So they created this strategy or SOAP, strategy on a page or SOAP, as an initiative for the organization to focus on growth, specifically over the next 5 years. So you'll see the year 2026 listed there as our end goal for these big goals that they have. So you'll see the mission that I just stated. Our vision is to serve over 50,000 clients and develop over 50,000 care professionals annually. And you'll see the associated revenue that they hope to achieve by this growth. Their strategy is going to be continuing to become regionally dense. So you'll see again on a map in a few slides how we are laid out as an organization. We want to continue to focus on the integrated continuum of care and be on the leading edge of value-based care. Our goal is also to be the provider, employer, and acquirer of choice through our culture of family. We want to provide the best-in-class sales for our clients and our caregivers. And then finally, you'll see our culture and our values, which is rooted in everything that we do. Our values are the acronym of CARE, so compassion, attitude, respect, and excellence. And attitude references that can-do attitude. So you'll see this posted in many offices wherever you are. Around the offices, you'll see this everywhere. And this is truly rooted in everything that we do as an organization. So we do like to have employees be aware of this acronym. So it might be something you want to commit to memory. This maps out the different divisions that our organization is made up of. Again, we've seen a lot of growth in the last few years. You'll see the different divisions include skilled care services. So that is in-home services where a PT or an OT or an SLP come into the home. and provide that one-on-one care that's needed. The organizations that make up that group are All About Care, Paradise Home Care, Virginia Home Health and Hospice. In the middle, you'll see our in-home care services, which is the biggest part of our organization. And so this group is staffing PCAs and CNAs in the home. So they provide bathing, dressing, cooking, those kind of in-home services to help our clients. There are several groups that make up that division as well. So we have Care Advantage, which is those original offices prior to growth. Then we have Capital City Nurses and Coastal Home Care. That is our kind of make up our northern region. So you'll see where they're located on the map. And then Silver Lining Home Health, which is a recent acquisition that we had, and they are in Delaware. And they're also kind of fall under that Capital City Nurses umbrella, but they also provide that in-home care services. And then finally, we have our supplemental staffing division, which is Nurse Advantage, and they help provide additional staffing of CNAs, RNs, and LPNs. They provide staffing for nursing homes, hospitals, as well as prisons. So here you can see the map of the organization and where all of these offices fall within the 4 areas that we serve: Virginia, DC, Maryland, and Delaware. And you can see at the top in the left, you'll see the color coding. So you can kind of see what that branding is for each of those organizations and where they fall on the map. So, of course, our company culture begins with those mission, vision, and values. We want to care about our community and grow our business, but it also includes caring for and supporting one another. We want to celebrate the successes of our team members. We also value creative and intentional risk takers. By that, I mean we enjoy having people on our team that aren't afraid to speak up and offer new ideas. So as you're getting to know your role over the next few weeks, if you see that a process could be improved in a certain way, don't be afraid to speak up and offer that new idea. We definitely want to continue to try new things as we're going as an organization and find the best way of doing things as we continue to grow. We do want to keep in mind that this is healthcare, so it is a fast-paced environment, no matter what position you're joining us in, whether it's an office position or a clinical field position, it will be a fast-paced environment. As healthcare is ever-changing and complex, there'll be a lot to learn, so be ready for those changes as they come down the pipeline. Another part of that fast-paced environment is as how we continue to grow as an organization. So you can see that those original offices in pink were here, and that we've continued to grow as an organization and acquire new groups over the last few years. And we have a lot of growth to come over the next 5 years. So that is a key part of our organization. And this will require great teamwork in order for us to be effective in this. There are many ways to be an effective team member. We want to appreciate the strengths and differences found in others. Everyone brings something valuable to the table, so we want to be aware of that and make sure that people are able to use their skills to the best of their ability. We also want to appreciate the strengths and differences found in others, be open to suggestions and constructive criticism, and be engaged with the individuals on our team. We also want to be sure we're actively listening and communicating effectively with our team. When we have that open line of communication, we're able to lean on one another and support each other, and then we can celebrate those successes together. Of course, any workplace requires effective communication. I won't go through every bullet point, but these are just a few points on how to be effective, have effective communication here at Care Advantage. A few key takeaways are to ensure that your message is clear, professional, and relevant. We don't want to be vague in our communications or leave anything open to interpretation. And we also don't want to assume any malice intent as we're communicating with each other. Communication is key to making sure any operation runs smoothly, but it is critical when we're providing exceptional customer service. This means going above and beyond what our clients expect, to take that extra step to make sure that they feel that you understand what they're going through and you want this to be the best experience that they've ever had. Just so we're all on the same page, if you've never worked in home health, a majority of our clients and patients are initially hesitant about receiving those in-home services. So we just want to be aware of that and patient when we're evaluating their needs. We want to make sure that we're here to make sure that they know that we're here to meet and exceed their expectations, ready to handle surprises, knowledgeable of services and support offered across the board, and practice self-control as we're dealing with those different personalities and situations. As mentioned before, healthcare is very fast-paced and changes often. So time management is going to be your best friend. This chart breaks down different ways in which we spend our time. Maybe you don't think about it like this, but it may be helpful for you to do so. Quality of time is, of course, where we want to spend most of our time working on relationship building, prevention, improvement, recognizing new areas of opportunity, and planning. But of course, there are going to be those deadline-driven projects, crises, and pressing problems that come up that we have to jump our attention to. You also have your distractions and time wasters. So those help break up the day. I like to use those as a brain break, but we just want to make sure that we're not spending too much time there and really focusing in on that quality time quadrant. When we do this effectively, we become more productive and reduce our stress. We also improve our self-esteem, and we can reach our goals more quickly because we're more confident in our role. Once you've mastered time management, it'll definitely make embracing change a lot easier. We've all had to embrace a lot of change over the past few years, and it has definitely put us to the test when it comes to be able to handle a change in routine. There's some ways to be effective in embracing change. Be determined to learn new things regularly, learn what's important to the organization, get outside of your comfort zone and learn to be flexible. We know that change can be difficult, but it does offer so many benefits. Some of those include improved quality, quicker results, increased growth potential, and being able to serve and explore new markets. So we're able to bring in new clients and see, what areas we can expand our business into. And finally, building trust is an important part of being an effective team member and employee here at Care Advantage. One thing I will say is that we're not a company of finger pointers. So if a mistake is made, we just want to make sure that we are tackling it, handling it, and moving forward and learning from it. So we want to listen for understanding, provide open and honest feedback. And this really allows us to build trust with our team members and with our clients. When we have this, not only do we have trust within our organization, but we have market and societal trust, enhanced innovation, positive and transparent relationships. This also allows for heightened loyalty and engagement among our team members because we feel more connected, we can trust one another, and be confident in our day-to-day activities. So now we're going to jump into the employee handbook. That was attached to the welcome email you received. So you can take a look at that. It's also on ADP, and I'll show you where to find that. But you can definitely take a look if there's something specific that you're curious about. We'll only touch on a few pieces of the handbook today. One of the most important things to highlight is HIPAA. This is in place to protect patient health information from being disclosed. HIPAA is made up of two parts. The privacy rule establishes the standards for protecting that patient's medical records and other protected health information. It addresses how this information can be used and disclosed, and there are penalties in place if you improperly disclose or misuse that information. The security rule establishes standards to protect electronic personal health information. So there are specific requirements laid out to ensure that that is handled in a confidential manner and that it remains secure to ensure compliance. A couple other things we like to note is our code of conduct. Be effective and productive, kind, truthful, and professional. Use time management and good judgment. We are an equal opportunity employer. And we also like to highlight our employee complaints policy as we do have a commitment to open communication. So as you're going through getting to know your job, if there's anything that you come across that you're concerned about, please don't hesitate to speak up. We do want to address those concerns as they come up. We don't want employees waiting till annual review time to bring those concerns. So please do address them with your supervisor, and you can also come to HR if you need to speak with us. We do have a referral bonus going on for our whole organization as well as skilled staff. I'll be sending out additional information to you regarding that, so keep an eye out for it. Payroll and overtime. Payroll is Monday to Sunday, and payday is on Friday. If you're an office employee, you'll be paid every other Friday. Non-exempt are eligible for overtime. It just needs to be pre-approved prior to working it. One other thing to note is our office closing policy that is handled at an individual office level. So corporate does not make those calls as we are so widespread. So you'll want to just reach out to your direct supervisor if there's any sort of inclement weather and you're wondering if the office is open or not. Otherwise, you'll want to report to work unless you're notified otherwise. Now we'll jump into the harassment and bullying training. Again, there is a short 10-question quiz that you need to take. The link to that is in the welcome email that you received. As long as you're paying attention, you shouldn't have to take any notes. So it is important to note what harassment is and isn't. Petty slights, annoyances, and isolated incidences, unless they're extremely serious, do not rise to the level of illegal harassment. It does become unlawful when you have to endure the offensive conduct as a regular part of your workday, or a reasonable person considers that behavior to be intimidating, hostile, or abusive. It's also important to note who the harasser is. This can be the victim's supervisor. That's what we typically think of, but it can also be a supervisor in another area, an agent of the employer, a coworker, or even someone who doesn't work for the organization, but is just in the building on a regular basis. And the victim is not necessarily the person that is being directly harassed. It can be anybody that is affected by the offensive conduct. There are 5 types of harassment: discriminatory, physical, power, psychological, and sexual harassment. Sexual harassment can actually be divided into 2 types. There's quid pro quo, which literally means this for that, and that is when your employment benefits, like getting a raise or not getting fired, are tied into giving into some sort of unwelcome sexual advancement. Hostile work environment is where you have to deal with an offensive sexual conduct of any kind as a regular part of your workday. Bullying is another thing we want to avoid in the workplace at all times. This can look like aggression, intimidation, humiliation, undermining, and rumors. This causes stress for all. It increases the rates of physical and emotional illness, and this can result in higher turnover, loss of productivity, and increased medical costs due to increased stress at work. Bullying creates a toxic work environment for everyone involved. And a type of bullying, of course, that is most prevalent nowadays is cyberbullying. Social media has made this very easy for people to bully and cause widespread damage while also remaining anonymous. If you ever experience any kind of harassment or bullying in the workplace, we want you to make a report of the experience so we can investigate it. There are a few simple steps you'll want to take. First, you'll want to ask the harasser to let them know that their behavior is not welcome. If this doesn't work or you're not comfortable doing this, please report the behavior immediately, either to your direct supervisor or to Human Resources. We'll then ask you to put the report in writing so that we can have the events, a summary of the events as a part of our investigation. There are a couple things to note when reporting harassment and bullying. There is no statute of limitations. So that just means there's no express time limit for you to initiate that complaint. Of course, we want you to let us know about it as soon as it happens, but there is no express time limit for you to come forward with any concern that you might have. There's also no prerequisite to reporting. So that just means that you do not have to have direct communication in order to make a report of this behavior. One other important thing to note is the subject of retaliation. We do have a strict no retaliation policy here at Care Advantage, but it's important to define what it is. This occurs when an employer takes an adverse action against an employee because they've reported some sort of safety, health, or well-being concern. Of course, this has a negative impact on employee morale because people do not have or are not comfortable coming forward to report these things. Adverse action can look like firing, demoting, disciplining, falsely accusing, reducing hours of pay, or even making threats. People don't feel comfortable making reports when a retaliation occurs because they feel that something might happen to them. But the company is committed to upholding our no retaliation policy, and we do not permit any acts of bullying or harassment in the workplace. Some of the ways we're committed to upholding our policies is we do require an annual harassment and bullying training for all employees to review. All new employees are required to attend this training, and we do offer additional education to leadership and anyone else as needed. We do have a strong code of conduct in place and consequences. We will receive, when we receive reports as the HR team, we do take all of those very seriously and investigate them promptly and take corrective action as needed. So now we're going to jump into time off benefits as well as ADP. Again, you'll just want to take that quick 10-question quiz after orientation is over. It's the SurveyMonkey link that you'll see in the welcome email. So if you're joining us today in a full-time capacity, you will accrue 17 days of paid vacation a year. That equates to 5.23 hours every other week. We do have a maximum of 40-hour rollover. So as the year, the end of the year approaches, you'll want to take a look at your PTO and make sure that you've taken your time so you don't lose any time. And I'll show you a calculator that ADP has so you can make sure you don't lose any time. We also have 10 paid company holidays, and those are listed in the employee handbook. If you're curious what those are, you can go into the employee handbook, hit Control F, and type in holidays, and you'll see where the holidays are. We do have health benefits, and you are eligible first of the month following 30 days. We have 3 medical plans, 2 dental options, a vision option, and then we do offer optional life, which you can get on yourself, your spouse, and your children. These are all through Cigna, and I'll be sure to send out the booklet to you so you can review those options. If you elect not to enroll in health benefits, you will be automatically enrolled in the 3 company paid plans, which are term life insurance, which is 2 times your annual salary up to $250,000. Short-term disability, which is 50% of your weekly income up to $400, and long-term disability. So again, these are 3 company paid plans that we offer, and you will automatically be enrolled. There are a couple additional benefits that are not listed here. You can enroll in a buy-up short-term disability plan, which offers additional short-term disability coverage should you need that. And then we have 3 supplemental health plans. So there's an accident plan, an hospitalization plan, and a critical illness plan that you can buy for yourself and your family if you want to participate in those plans. And more details are available in the benefits guide. A couple of additional benefits that we have are employee discounts through LifeMart, and I'll show you where that is in ADP. We also have Call-A-Doc, which is a telemed service. There is a telemed service included in the medical plans that you can enroll in, but if you need coverage between now and when you're eligible, you can go into ADP and complete that enrollment. You're eligible now. It is like a PCP, and you can enroll up to 5 people in your household. There's education reimbursement available. Details on that are in the employee handbook. We also have Virginia Credit Union membership, so if you want more details on that, please let me know. And we do have a 401k through Nationwide. You're eligible after 12 months of full-time employment. Enrollment is done biannually, so we have an enrollment period in late December for an effective date of January 1st. and another enrollment in mid to late June for an effective date of July 1st. I will note that the company doesn't currently match on the 401k plan. It's something we hope to have soon, but there's no current company match. This is just a final plug for new hire documents. So please make sure that you send over 2 forms of ID so that we can complete your I-9. We need that within 3 days of your hire date. Also a copy of your vaccination card if you have one. And then any credentials if you're joining us in a clinical capacity. So your licensure as well as your CPR card and any car insurance you might have. All right, we're going to move forward into the ADP demo. So let me get that part on that screen shared for you. Hold on one moment. Okay, so this is the login page of ADP. When you go to workforcenow.adp.com, which is the version of ADP that we use, I like to highlight that as there are several versions of ADP available. The link to that is in the welcome email, so you will be able to copy and paste that if you need to. As you're new, you're going to create your account. So where it says new user, you will click on create account. And in the welcome email, there is a registration code that you received. So you'll click, I have a registration code, and that code that's kind of a combination of random numbers and letters. You'll copy and paste that code here, and that's linked to your account. So then you'll put in some identifying information and be able to create your username and password. That is something that you'll have to create and get your account set up. That's not something that HR or your supervisor will be able to do. So you just want to make sure that you use that personal registration code to get that process started. Once you have your account set up and your login information created, you'll be able to go in and log in ADP. And once you get logged in, this is the homepage of ADP. Right now we are going through open enrollment, so that's what is on the homepage. You may be joining us in a different capacity and it may not be open enrollment the time you join, but a couple things to note are the resources and myself tab, which is where you'll spend most of your time. If you click on resources and under company information, click on tools and references, you'll see a bunch of different pieces of information that you'll want to look at. So in the left-hand column, you'll see the employee handbooks. If you want to see a copy of the handbook, you can click here and I'll take you out to that page. And again, if you do Control F and type in holidays, you can see our company paid holidays are listed here. And you can view that at any time. A couple other things available to you that are important to note are the benefits guide. The benefits guide, as well as a summary of benefits and a summary of benefits and coverage. So if you're looking for specific plan details around our dental plan, vision plan, or various health plans, you can click on those and get all the information you need. And then finally, on the right-hand column, you'll see the human resources tools and guides that are available. So a lot of ADP is self-service, and by self-service, I mean that you can go in and make changes yourself to your profile, to your taxes, to your direct deposit. So we do ask that you utilize these guides. If you have questions about how to do different things, you can print your pay statements, print your W-2, submit PTO, enter your direct deposit. They're all step-by-step guides and they're really helpful. So I definitely recommend you take a look at those. If you go into the Myself tab, here's a couple other things to note. Your menu might look like this. If you click Expand menu, it'll take you to the expanded menu version, which is my preference. We do ask that you go into your profile and look at your information and make sure everything is correct, phone number, address, email. We just want to make sure that all that information is up to date. And you'll also want to go in and add your emergency contact information. If you plan on enrolling in benefits and are benefits eligible, under personal information, you'll be able to click on your dependents and beneficiaries and click add dependent or beneficiary. Input who you're putting in and what the information is. So if you're adding a beneficiary, you can click on the beneficiary and hit continue, and you'll be prompted to add in all their personal information. Please note that you will need to have their date of birth and social security number in order to put them in the system. If you are enrolling in benefits, under benefits, you'll see enrollments listed here. You'll have a new hire enrollment splash screen, but also this first tile will say new hire enrollment, and you'll be able to enroll now. If you want to complete Call-A-Doc enrollment, and that's something you're interested in doing, you can enroll in the year-round enrollment and complete that enrollment now. You can also manage your beneficiaries here, view your benefits once they're submitted, and then report any life change. So if at any point in the year something changes in your life, you have a baby, get married, get divorced, you can go in and make those changes, so that we'll be prompted to contact you and see if you need to make adjustments to your enrollments. One other thing to note under the benefits section is that discount portal called LifeMart. So if you click on that, it'll take you to an external website, which is called LifeMart, and there are a whole slew of discounts. It is updated regularly, so I highly recommend you go in and take a look. If you're traveling, switching insurance, making some food, whatever it is that you might be doing, there's a bunch of different discounts available. I've used it for travel and it's been helpful. It's definitely something to look at as an option to receive a discount. A couple other things to note under the Myself tab is the pay section. So if you go under the pay tab in the menu, you'll see a couple things. Under payment options, that's where you can update your direct deposit. So you'll click on that and input your direct deposit information. You can input up to 99 accounts. So if you want to set up multiple accounts to put some money in a savings account or a college fund, you can definitely do that. You can also view your pay stubs as well as your W-2s here. So you click on that and you can see your pay stubs as well as your W-2s at the end of the year. And finally, you can update your tax withholding information. I will update your tax information once I receive your new hire forms. But if at any point during the year you need to make an adjustment, you can actually go in here and update those, both federal and state tax information. And finally, the last thing I like to note is your time off. So if you go in here and click on My Time Off, you can make requests. So you would click Request Time Off and put in your dates and submit the request. It'll go to your direct supervisor for them to approve it. This calculator tool is what I was speaking about before, because you can go in and see how much time you've accrued at different points in the year. So it's really helpful. You can go into the end of the year and see how much time you have left, so you know how much time you need to spend before you lose it. Again, you can only carry over 40 hours, so you just want to make sure that you've planned out all your time. As you can see, I have 25 hours that I need to use in order not to lose any time at the end of the year. So those are the basics of ADP. If you have additional questions, please don't hesitate to reach out, and also feel free to use the tools and references. All of these guides were made either by ADP or by us in the HR department. So it'll walk you through how to go through each of those processes. Well, I thank you so much for joining today. Again, if you have any questions, you can reach me via email. I did send that welcome email to you. You can also reach me at my extension, which is 4109. And again, my name is Casey Compton. I'm the HR generalist and benefits specialist out of the corporate office. Thank you so much, and I hope you have a great first week. Bye-bye.